Welcome back to lesson 4 of abnormal psychology. Today we are looking at personality disorders. I want you to tune on up to the end of this course because we are going to look at personality, which is going to be helpful and which is going to make you thrive in life, and also as a student of psychology and as a counselor, it will be able to help you on how to tackle issues which deals with personality. The lesson is coming from this book entitled Abnormal Psychology by Dr. Tulipo Mweni Fumbo. And in this course, we are going to look at personality disorders, definition and symptoms of personality disorders. Then we are going to look at causes and risk factors for personality disorders. And we are going to look at treatment options for personality disorders. As I said, this is your host, Dr. Tulipo Mwenfumbo. You can order some books. I've written quite a number of books, and you can be able to order them. And we offer varieties of courses, and all the courses that we offer are online. And you can be able to do a bachelor's degree, and bachelor's degree we are offering the 4 years bachelor's degree in 2 years, but the material that you're going to be able to cover, it's the material which is 4 years. You know, the courses were 4 years, 5 years because of at that time, in those days, where the library was physical and you needed to do physical work. Now we are in the generation, or we are in the AI generation, where everything is at your fingertips. So there is no need for you to do a course for 4 years, because the work that we used to do as who learned in those days, which they did, we used to do maybe for 1 month, you can be able to do it in a day or in 2 days. So you can do any of your degrees in only 2 years, and diploma in 1 year. So the certificates, we are offering them at 2 weeks to 3 months. Welcome back to psychology, abnormal psychology. What is abnormal psychology? This when we talk about abnormal, or when we talk about personality disorders, we are talking about a group of mental health conditions that characterized by persistent patterns of thought, feelings, and behavior that divert from cultural norms and cause significant distress or impairment on an individual. So we are talking about a mental disorder, or a mental illness, or a mental health condition that is characterized by persistent patterns of thought, feeling, and behavior that divert from cultural norms and cause significant distress and impairment. We are talking about where a person becomes distressed because of his personality, or the personality that creates the distress or impairment in the mental health. How can we be able to identify this mental disorder, which is personality disorders? So, when you want to identify the personality disorder, there is what is called the symptoms. Symptoms are the physical or emotional uh, signs that you can be able to see in a person that have got this kind of illness. So number one, there is inflexibility and rigidity. that is the difficult adapting to change or new situation. There are people that cannot adapt, and there are people that cannot just change. They just want the way things were, and that's the way they want them to be. And others, because of their culture, even when they are in a different culture, they cannot change. They don't want uh, to adapt. So that can be also a mental challenge, which is the mental disorder. So that is the first thing. When you look at a person who doesn't want to change, they just want things to be the way they were, or what they believe in is what they want everyone to believe in, or well, that is what they want things to be. That is a mental disorder, which is called inflexibility and rigidity. It's a symptom of personality disorder. Then we have got impaired relationships, difficult forming and maintaining healthy relationships. So there are people, I've known somebody who cannot relate with anybody. So I was asking her, uh, who do you relate with? Who is just a good person in your life? Because everyone to her is bad, and that makes her to be very. It makes her to be emotionally disturbed. She becomes distressed because she cannot maintain relationship, and she just have she's just something else. She's a person that you cannot be with for 1 hour without any difference. You differ with her, and she'll not even see anything wrong about herself. She'll just see how people are unfair to her. That is a mental personality impairedness or disorderness. So there are those people that have got impaired relationships, difficult forming and maintaining any relationship. Some of them it's just to extent. So as a psychologist, you have to know that there is an illness like that, which is a personality disorder, which you can help somebody. Then there is emotional uh, dysregulation. Dysregulation. So this is difficult managing emotions, leading to intense mood swings. So there are people that have got are very difficult in maintaining emotions. They cannot regulate the emotion, because emotion has to be regulated. When somebody does something bad to you, you have to regulate, either to choose to be angry the whole day or whatever, or to change the mood. So there are people who don't have uh, dysregulation of their mood. So that is also a personality disorder where you cannot regulate your emotions and you cannot control your emotions. Then there is impulsivity, which is engaging in impulsive or reckless behavior, whereby you cannot have control over your behavior. There are people, I've known people whereby when he's found at a place where people are drinking, he's going to drink more than them. If he found people gossiping, he's going to gossip more than them. If he's in any negative device, he will do just like that, more than the people that he has found, even in positive things. So um, they cannot regulate their behavior. So it's just loose. Then there is also distorted self-image, having a distorted or an unstable sense of self. There are people that have got just a distorted, self-image. It is something that is very important in mental ability, or somebody to in mental health. So there are people that have just see themselves not well built when it comes to uh, physical image. They see themselves, they are not beautiful, they are not handsome, they are ugly, and what. Then when it comes to intelligent, they see themselves to be down, they are fearful, they think, yeah, the people don't see them. And you hear such people, they'll say, do people see us as human beings? As we are not respected. Yeah, they were not even told when there is a funeral. And there is that uh, which is, there are a lot of factors that creates distorted self-image. But there are people that are just like that. They are never positive about themselves or about what they do. What can be the causes of this disorder or health disability, which is personality illness? These illnesses can be caused by, number one, genetics. Family history of personality disorders can increase the risk. Um, you may find that a person is just born like that. It may be as a result of the blood that that person carries, because of the genes that that person carries. So they have always has challenges on himself, on personality, has challenges on coping up with people, he has challenges with image. So it can be that. Then there is also brain chemistry, imbalance of neurotransmitters. There are people like women, when they are uh, having the peace or the monthly periods, you may find that they lose their self-image. They begin to see themselves bad. So there is just that where they begin to have a challenge in personality, the way they perceive things, and also when they are pregnant. So there are those brain chemistry, and also there are just some times where maybe because of stress, that person begins to feel like that. Then the childhood experiences, you know, um, when we are growing up, childhood has got much influence on how we are going to do how we are going to be when we grow up. So some people, they have got that challenge because of how what they experienced when they were growing. Traumatic and stressful experiences during childhood, they can cause one to have low self-esteem, and one to not to have good relationships with other people, and it can cause one to be rigid, and not to function well in his or her mindset and the perspective of the world. Then there is social and environmental factors. Social and environmental factors such as poverty and social isolation. I was saying whereby because of poverty, one begins to see that I'm not respected, people cannot respect me, my family doesn't consider me, and all that. So it causes some personality, some disorders, illness, mental disorder. So it reduces the self-esteem, it reduces the relationship ability. You know, this happens so much to men. when he lost, or when we stop working and he loses, maybe he's not earning, they do have the challenge of personality disorders, whereby now the wife becomes a problem. When whatever the wife does, you are doing this because I don't have money. You are misbehaving because I don't have money. I'm not respected in this house because I don't have money, or because I'm not working. No, and it creates a bad relationship with people, and it makes it even creates divorce. Most of the divorces that happens when there is a loss of income in a family or in a man's pocket, you find that it may not even be a problem of the wife, but it may be his problem because of personality disorder, whereby the image is disturbed, and also there is like this symptom of you can't go along with people. So many people, when they face such challenges, they begin to isolate themselves, and they begin even to say, my friends have deserted me. Yet it is you who is not trying to cope up or to relate with your friends when you don't have money. So that becomes the mental illness, which is a personality disorder. Now, there are what are called risk factors. We said the family history can be a risk the factor for personality disorders. Then trauma, experiencing a traumatic event such as physical or emotional abuse. So that also challenge comes in when one was maybe abused, where when he was a child, even sexually abused and other abuses, they can create such factors. So when you have a certain experience, it can disturb or destroy your personality, and it may cause personality disorder. Then stress, or ongoing stress and significant life changes, it can create the what is mental disorder. This challenge is so much common to the people that are above 40s because of the experiences that they have gone through. They lose focus, and they begin to see that the world is not in favor of them, and they begin to live the life of negative, and the personality dramatically just changes, and that makes people not to be productive. Then there is substance abuse. When people are using drugs and excessive alcohol, you may find that they begin to lose, which is personality. They begin to develop personality disorder. So they begin to lose their confidence. They begin to have bad relationships. Why? Because of this because of taking or abusing alcohol. Then there is the personality traits. There are certain personalities that also creates this disorder, like the personality which has got who are perfectionists, like the uh, and also those that have got low self-esteem, like phlegmatic and also melancholies. They face personality disorders because of their the way they view life. The pragmatics, they view life, they don't have self-confidence, they have no self-esteem. And same like with the melancholies, where they have got they want things to be on point and perfect, and when they realize they cannot reach that, it creates some personality disorder. Then there is also spiritual exposure, whereby a person begins to face that because of experiencing demonic or occultic uh, being in a cult, or whereby you are following a false prophet where he's just intimidating you and telling you a lot of things that brings some negative thoughts, and you become possessed demonically, and your personality just changes. So now, what treatment and options for personality disorders? There is psychotherapy where you use cognitive behavioral therapy. This helps individuals change negative thoughts, patterns, and behavior. So you use cognitive behavioral therapy. I want to know that if you have any, you need to see class in counseling, then you are going to find these uh, these theories, like these therapies. Then there is direct core behavior theory helps individuals manage emotions and behaviors. Then psychodynamic therapy. So you use counseling and psychological therapy to help a person change or bring healing to the disorders. Then there is medication therapy where the medical is applied, like antidepressants, the medication that can help reduce symptoms of depression or anxiety. Then there is also mood stabilizers, which is the medication that can help stabilize the mood. Then there is what is called anti-anxiety medications, which that can help reduce anxiety. Then there is lifestyle changes where a person should change the lifestyle. That is, exercise, regular exercise can help reduce symptoms of personality disorder. Also, sleep hygiene, establishing a consistent sleep hygiene, which can also help in creating what is called personality disorder. The other therapy that can be used when it comes to life changes is uh, so establishing a consistent sleep schedule, which is the sleep hygiene, can also help in uh, lifestyle change. Then there is also health diet, eating a health diet rich in fruits, vegetables, and whole grains. That can also help the in mental disorders. The other alternative therapies that can be used mindfulness based on therapies. When we talk about mindfulness based therapy, that is where now meditation, relaxation, and where a person focuses on now and today. You know, some of these personality disorder, because they come because somebody is worried about tomorrow, somebody is worried about losing the relationship, so it creates bad relationship with other people. And also, because of the past experiences, you begin to bring the past experiences into the present, so that creates disability in your relationships. And also, it makes you to have a different perspective and failing to cope up with a situation at that particular moment. Then there is herbal supplements, certain herbal supplements such as omega and fatty acid may help reduce symptoms of personality disorders. Then there is acupuncture therapy, a therapy that involves inserting small needles into specific points on the body. Then there is also whereby it's spiritual therapy, whereby one goes for pastoral counseling, prayers, and deliverance. Um, so we have looked at personality disorders as a complex mental health conditions that requires comprehensive treatment. So understanding this kind of so we also looked at understanding the definition, symptoms, causes, and risk factors can help individuals seek effective treatment options, including psychotherapy, medications, lifestyle changes, and alternative therapies. You know, as a counselor and as a psychologist, it's very important to you for you to understand the causes of personality disorders. That will create that will create your work as a psychologist to be easy and also to help a lot of people. Thank you so much for being with me in this class, and you can remember to order this book, which is Abnormal Psychology. We have got the this book on it as uh, uh, physical book, which is a hard copy, and also we have got soft copies. Thank you and God bless you. Let's meet in lesson 5.